Hey guys, what's cracking? Dr. Eric Smith today, and I have Kensi, aka Pretty Bull Kensi, here in the office, and we're going to adjust her today. So Kensi is a 12-year-old badass who is studied Jiu-Jitsu, you said wrestling, and what else? Muay Thai. So she's into all that. Definitely not a patient I want to get mad who's going to come after me, armbar me, and then I need to go to a chiropractor to get fixed. So today we're going to be working on her, and what I've been working on with her lately in the past is she has some curvatures going on in her spine. Some people would call it a relative level of scoliosis, but it's really at this point, being 12, that she's still growing. She's still getting a lot of length in her. Her spine is still lengthening as we do that. So we want to make sure her muscles are loose, especially with the sport she does. But we also want to have stability, because in this sport and a lot of these sports, you want to be flexible and move, but you don't want to move too much, because if a joint pops out, you're going to be like, no good, right? So what were the two, did you, like last wins, they tap out, or how did you get them?
Yeah, both tap out and submission and point by points.
See, this is why I'm not messing with her. I'll just move her spine, and we'll get her healthy and keep her on the right team. So as for today, you were saying this left side of you is what's bothering you the most, right? Like kind of through here?
Mm-hmm.
All right, anything else bothering you?
And my right ankles.
One thing you'll like about this video, those of you that are into lots of pops and cracks, she is like bubble wraps. So we're going to hear a lot of that, as well as I'm going to get into a lot of her joints, because it's very, very important not only that we keep them healthy, but we keep them moving so she doesn't get in a position where she's in a lot of pain and has to tap out as well. So I have adjusted her before, but just looking at some like range of motion things to see where she's stuck. She's complaining of left trap pain, so she's got some restrictions in there. And some of you that are students to motion or chiropractic, physical therapy, you would probably say like, no doc, that's normal range of motion. But Pretty Bull Kensi here is flexible, probably more than most Pretty Bulls I know. So squeeze your shoulder blades together for me. Good, so she can get in position pretty well. And she's complaining back here of her left trap, kind of right where her shoulder is coming across, attaching here, and then going into her trap, and then back underneath, she probably has some relative ribs out of place. But if you could see the imaging she had, you would know that she has a little bit of a curvature going on. We've been working with that. And last time we did this like lateral break move of her thoracic spine and lower cervicals, and it moved a lot. So, because you heard a lot of pops with that one, right?
Yeah.
You made some noises, so that was good. Awesome. Let's check out kind of your shoulder range of motion. I know last time we got a big cavitation out of that too, that you're like, oh, that was a lot. So it's good. So how much are you training? You train like 5 days a week right now, or how much?
5 to 4.
Okay. Awesome. Awesome. So let's check you out. Go ahead and lay face down for me, please. So this girl has some of the best kicks in town, by the way. Rumor on the street is that mom facilitates the sneakerhead life, from what I heard, so which is great, because I'm a fan. This woman comes in with the best shoes of some of my patients. So not too far off of what we see down there. And as you can kind of see that her right side's more anterior, so it's shifted that way. And then as we go across, she's got a little curvature through here. Looking at her back, this is what I was talking about. What we look for is kind of muscular curvature and hump, and so hers isn't straight. So we're working on, while we still can here, getting these thoracics to be a little bit straighter, because her being 12, her growth plates typically have not fully closed, so there's a lot more room for us to fix things now versus trying to get it later. So those of you that have children that are in sports wondering like, oh, they're young, they don't need adjusted, I completely disagree with that. You should have them adjusted, fix the things now so they don't have that problem. So she's living proof that having curvatures like that, can they help with her performance and feeling better later? Yes, but it shouldn't stop her from doing things. And so this young girl's kicking butt in the sports that she's into, and hopefully we'll drop a little of her highlight films in this clip, but Dad showed me some last week, and more of the reason I'm not messing with them. Kind of pushing through, lots of just restrictions through here, and then right through there again, which is probably giving her more of a pull there, and whatever she did over here. So, cool. All right, so let's get into kind of what I'm going to do for the adjustment. So with her, we're lengthening her spine, so I like to use this table to just open up her spine a little bit. Some of you may know this is the flexion distraction technique. So we use this table, and I just block some of her spinous processes on the back of her spine here, just lengthening it and getting some more space to open up in the joints, because a lot of times, yes, she's lean and mean, but getting some pressure off that spine will help out a lot. So just a little bit of pressure to open those joints up, and make it feel pretty good. And that's really what we're trying to do at this point. So by doing this too, I can see how her spine's reacting, and she's definitely been training hard because her muscles back here definitely need to get some stretching going on and some pressure off there. So just a little bit of that. Recheck where her leg lengths are. So as you can see, pretty flexible. Boom. It's awesome. So good stuff there. And then we're going to do some easy adjustments in here. Nice deep breath. Let it all the way out. Awesome. Good work. And then right through here, got some more deep breath. All the way out. Good. Okay, so let's see if we can get this move again. I'm going to come on the other side. Let those arms drop to the side here. Just let that relax. Very good. Let that neck relax for me. Ugh. How'd that feel?
Good.
Good. Good work. So it's very helpful because she trusts me. She's letting everything go, just relax, so it helps a lot to get some of those things moving that way. Because she's got this little thoracic rib going on, this is an adjustment I usually like to do for that. Let your neck relax again for me. Good. Awesome. Let's fix that low back of yours. Go ahead and lay on your right side for me. And you said November is your next big contest? Mm-hmm. Okay. Let that relax for me. Good job. When's the first time you got chiropractic care? Remember?
About a year ago.
About a year ago.
Mm-hmm.
Awesome. That relax for me. Oh, actually, let's put this hand here. I haven't dropped anybody. You're not going to be my first. And so you how long have you had your nickname?
About a year too.
About a year.
Yeah.
So adopted. So about a year, got a nickname, got a chiropractor. That's good. And what are some of the main companies you like to work with for clothing?
Nike and Jordan.
There we go. There we go. So those of you at the Nike team, you should pick this girl up. All right, a little bit right through there. Good. Woo. It's not as smooth as the last video I saw of you getting that girl to tap out with the armbar, though. That was more smooth. We're gonna do a little bit more in your thoracics, and then we're gonna get into your extremity adjustments, okay? A little bit through here. Nice little hug. Deep breath for me. Let it all the way out. Breathe it out. Good. Awesome. So you said your ankle was bothering you?
Yeah.
Let's see what we got going on. So I normally like to check for plantar flexion and then what's called dorsiflexion. So she usually gets stuck a little bit on dorsiflexion. Scoot down a little bit more for me, Kensi. Cool. And so what dorsiflexion is that? So when this doesn't move that way, because your two bones should slide like that, like this, and hers is jammed. So I'm assuming this is going to move pretty good. A little movement through here. Good. How'd that feel? Good? How are the knees?
Good.
Good range of motion through her knees. So with this, the wrists should move in like all directions, which are very important for her. And when they're stuck and she can't do anything like that, then you can get her to really tap out if you push too far, or the other way, things like that. Things that she probably knows how to do to other people to bring pain and harm to. Is that relaxed? Good. Good. Other wrist. And where are you currently training?
Palm Beach Gardens, PBGMA.
A little shout out for them. Let's check out those shoulders. So go ahead and face that way for me, please. So remember this one, we're gonna put your hand on your hip, and then you're gonna flick that back real quick. So let that relax, so get in the right position. Go ahead. Good. Let's go to the other one. Come around the other side. Go ahead. Awesome. Cool. So we're going to end up doing some muscular stretching up here to get this trap, but I wanted to show you the adjustment, mainly what we do. Kensi, anything else hurting you?
No.
Awesome. Well, I appreciate you coming in today, getting a video. Check her out, follow her if you want to learn some great techniques. What's your favorite submission hold right now?
Armbar.
Armbar. Armbar it is. So check it out. Appreciate you guys watching. See you on the next video.